Hi, it's Abby from ALC Courses. Following on from a series of clips I'm showing you regarding CPR and the current COVID-19 crisis, I'm going to focus now on infant CPR. An infant is defined as from birth to roughly 1 year old. I'm going to start by reading you out a statement from the British Resuscitation Council regarding the COVID-19 crisis and CPR on infants and children. It's likely that the infant having an out-of-hospital cardiac arrest will be known to you. We accept that doing rescue breaths will increase the risk of transmitting the COVID-19 virus, either to the rescuer or to the child or infant. However, this risk is small compared to the risk of taking no action, as this will result in certain cardiac arrest and the death of the infant. When we do infant CPR, we have a few considerations to take into account. It's a very sensitive subject, but at the same time we do need to have the baby on a flat surface. This surface could be a raised surface like a table, as long as we have the control of that situation. What we can't do is have the baby in a pram or cot, because this will lead to bounce as you're doing CPR and the compressions won't be effective. Like on any of the other categories of people we do CPR on, we still need to achieve a third depth of the chest to get the right depth of compressions to pump the blood around the body. With a baby, we're going to start by giving 5 breaths. We're going to put our mouth over the baby's whole mouth and nose, basically because it fits. And we're going to put 5 breaths in, then we're going to do 30 compressions using 2 fingers to do those 30 compressions. Then we're going to go back to doing 2 breaths. So we're going to do 5 breaths and then 30 to 2 until an ambulance arrives. When we open the baby's airway, we need to be really careful because the baby's trachea or breathing tube is soft and flexible. It hasn't gone hard and formed like a child or adult. So if you accidentally tip the baby's head too far back, if you imagine the trachea to be like a hose pipe that is soft and flexible, if you tip the head too far back, it could actually cause the airway to kink and you could re-block it by overextending the head and neck. So bear this in mind when you first tip the head back to do the breaths. Put your 2 fingers in the centre of the chest. Then 2 breaths that continue at a rate of 30 to 2 until the ambulance service arrives to take over. We're aware that paediatric cardiac arrest is unlikely to be caused by a cardiac problem and more likely to be a respiratory one, making these ventilations crucial to the baby's chance of survival. For those not trained in paediatric resuscitation, the most important thing is to act quickly to ensure the baby gets the treatment they need in this critical situation. For an out-of-hospital cardiac arrest, the importance of calling an ambulance and taking immediate action cannot be stressed highly enough. If the baby is not breathing normally or not breathing at all and is unconscious, and no actions are taken, their heart will stop fully and cardiac arrest will occur. Therefore, if there's any doubt about what to do, please do what I've been showing you today.